And good afternoon, everybody, and welcome. Great to have you here on this Saturday afternoon. I'd like to introduce some colleagues of mine who are going to help me to present this presentation for us this afternoon on career changes, particularly around armed forces. And in the top screen there, we have Ben White, OT student from Derby University. And then we have another colleague of mine who is David Williams, who is a former Royal Marine and is a physiotherapist. What we're going to do for you this afternoon is give you a brief presentation, and then what we hope to do is answer any questions that you may have about career changing, particularly that of from moving from the armed forces to that of an AHP. So what we have in front of us here this afternoon is a presentation to allow us to support you in moving from one career to another. And what we've been doing at Health Education England is we've been trying to attract armed forces personnel to become the future AHP workforce. And what we've got for you is some ideas and some potential opportunities. So, as I say, we've got myself. My name is Paul Chapman. I work for Health Education England, and I am a physiotherapist, and my function is to look at workforce supply going forward. And what we're particularly looking at is workforce supply for individuals who want to do career changes. As I say, we've also got Ben White, a third-year occupational therapy student from the University of Derby, who was a former Lance Corporal in the 9th and 12th Lancers. And as I said, we've got David, who is actually a registered physiotherapist working at University Hospitals Derby and Burton, and he is actually a former Royal Marine. I think the secret for all of us is about being ready when our opportunities come. And when it comes to changing careers, one of the hardest things is actually, what do I want to do? You may want to change your career, but you're not sure what you actually want to do. So we reckon it's actually being ready and prepared for any opportunities that actually come your way. So our project is about attracting career changers. Now, we're looking at all people who want to change careers, particularly with the climate as it is at the moment. There'll be lots of people who unfortunately are being made redundant, and may see this as an opportunity of picking up something new going forwards. But what we've particularly done is we've actually looked at how we could support our armed forces personnel to become future AHPs. So what we plan to do today is to highlight how the role of an AHP can be used to support people in health, education and social care. And what we've done is we've raised awareness through the projects that we're going to show to you today, and how that can be moved forward. So we're working in collaboration with key partners, Health Education England, Step Into Health and other individuals within the military. We've developed some solutions, and what we hopefully will do is develop further solutions which will help you as an individual to actually move from your former career into a potentially new exciting career as an AHP. And as I say, what we hope to do is use the learning from this programme as a stepping stone to support those who may be impacted by the current situation as it is at the moment. So let's give you a little bit of a background. What do we know? Well, what we do know is that roughly 14,000 to 16,000 personnel will leave the armed forces each year, bringing with them spouses and partners and dependents. For us, this is a real big opportunity to try and see if we can attract those individuals to become AHPs of the future. What we've identified is that everybody who is doing a career change, particularly those in the armed forces, bring with them some transferable skills and knowledge that can be used within the healthcare sector. Therefore, we've worked very closely with Step Into Health to provide a link between the forces and the NHS. Step Into Health is an actual arm of NHS employers who are partners of ours. And what they do is they support and they showcase the potential careers that are available for you as a career changer as you go forward. particularly linked to the armed forces. Many of our armed forces personnel have actually become AHPs, and as you've seen already, we've got 2 examples of that, and we'll be showing you some more examples later. So, what is an AHP? Now, you've probably come and you've probably seen some of the other events today on the platform. Well, as an AHP, an allied health profession, that's what it actually stands for, we're the 3rd largest clinical workforce in the NHS, behind our doctors and nurses. We work in the health, social care and educational teams or settings. We make a massive difference to the health and social care system by the work that we actually do. And as an allied health profession, as an AHP, you can become an autonomous practitioner who will be able to diagnose, work in technical areas, work in a therapeutic area, and also work directly with patients and support services going forward. In fact, allied health professionals are key to the delivery of the way health is delivered in the NHS in other sectors. AHPs are critical to the population that they serve, and in some cases, without an AHP, that individual is not going to improve or be given the best care possible. It's actually possible for some AHPs to actually lead services, and what we're currently doing within the NHS is developing what we call the first point contact practitioners, whereby they actually lead services, or you may actually be able to see that person without having to see any other profession. All AHPs are registered clinicians, which means they are protected and you have a protected title behind what you actually do. You've probably, throughout your life, or somebody within your family or within in your social network, will have actually come in contact with an AHP throughout yours at some time. AHPs work in a vast area of places, and from the list that you can see there, it's possible that you've probably been treated or had treatment from one of those individuals. I know that my grandson, who's only 4 years old so far, has actually seen AHPs in his short life, and he's not actually seen a consultant or a nurse related to that, because the AHP has been able to deliver that care in the most appropriate environment. Looking at the pictures there, you can see there's a real variety of skills and knowledge that individuals will be able to bring to that area. So it's not just about leaving school and going and becoming an AHP, it's about using your current skills and knowledge in that environment. In a little bit more detail on this slide, shows you and tells you a little bit about those careers and what they had to offer. You can actually go into our booth and see a little bit more about the individual professions as they are. But as you can probably see, we've got a breadth of skills and knowledge that you can bring. So if you're very much art focused, you could bring your skills to that of an art and drama and music therapist. If you're more technical, you may be able to use it in the skills as that of a prosthetist or an orthotist, or a diagnostic or therapeutic radiographer. And then also we've got the skills of the physiotherapist, the osteopath, the occupational therapist, the dietitian, and the speech and language therapist. You'll be surprised what skills are available, and there is an allied health profession which will be able to cover and treat every part of the body. So what skills do I need to be an AHP? You need to be compassionate. You need to have empathy. The key thing is you need to be a team player, and most of us who are peers have worked in teams, but we've also led teams, so you can bring those skills to the table. Use excellent communication skills, and as I say, as a career changer, particularly those from the armed forces, they have excellent communication skills, and without those skills, they're not actually going to be able to work in any environment. You need to be curious and interested in learning, and that's the key thing about these career changers. They want a new challenge. They want to learn new things. You thrive on the variety of jobs that are available for you. definitely no day is the same. And that is particularly relevant for today, where a lot of our allied health professions are actually working in other areas to support the pandemic. You need to treat every day as a school day, because we always learn and allied health professions are always wanting to learn. And it's key that the skills and knowledge you bring can actually be passed on to those of your colleagues. You're keen, you want to be challenged, but you also want to change others. And that is clearly evident from our armed forces personnel, who are always being challenged in their current role within the armed forces, but they're also able to come out and help us challenge ourselves. You're going to be part of a massive community. As I've said, we're the third largest workforce in the NHS. But most importantly, you need to have a really good sense of humour, because I tell you, some of that sense of humour is something that gets you through the day. So what is there out there to help you, support you on your journey if you want to become an allied health profession? Within Health Education England, we've created some information for you to go and find, and the link is actually found at the bottom here, and it gives you an opportunity to go and explore all the different ways in which you can become an allied health profession, but also how you can actually become an allied health profession and what an allied health profession does. And what we've got is we've got the different routes and careers that are available, what it's like to be an allied health profession for the day, and some films. But we're talking about the careers and how you can go. And the best place to find that information is on the Health Careers website. We also are trying encouraging everybody to look at allied health profession as a career going forward. And hopefully this presentation will help you to encourage that. So, unless there's commitment is made, there's only promises and hopes and no plans. So what I'm hoping for you, if you are planning on wanting to become an allied health profession, then you're going to commit to going away and looking at the resources that we have in our booth. So what's the ask today? Well, the ask is that we at Health Education England and all allied health professionals ask you to go away and have a look at what's available. As I said, we're working very closely with Step Into Health, and that information can be found on their website as well as our website. And what we want to do is work in collaboration with not only Step Into Health, other providers, other areas within the sector where we could actually make a difference. So we'll actually be reaching out to the aviation industry. We'll be reaching out to the hospitality industry to attract those individuals and think, what about becoming an AHP? What are the opportunities for me? What can I actually do? Here we have some great examples, and I said I would show you some more examples later. And here we are. These are allied health professionals who were former armed forces personnel. And I would like to draw your attention to our great film that we've got, which explains what an allied health professional is. And that can actually be found on our Learning on the Booth. Here's why some of our allied health professionals are there today after having a former career in the armed forces. And as you can see what Ben said, in the aftermath of war, we helped so many people, had a huge impact on me, and I felt I needed to do different things in life. For him, it was about not just being in the armed forces, but it was about the other things that it gave him. We've got our music therapist, John, who actually at the end of the day was in the Royal Marines bands, but he actually wanted to use his skills and his music to help in the way that he had helped his sister. And then it's also from our diagnostic radiographer, who'd actually, his daughter was a diagnostic radiographer. So he thought, well, I could do that, so why don't I go on and do that? So as I say, all our information can be found in the booth for you to go and explore a little bit more. I hope you've enjoyed the talk. What we plan to do is have a quick chat with a couple of our colleagues, Ben and David, see what we can do to provide you with a little bit more information. Thank you very much. Okay, David and Ben. Ben, do you want to just give us a little bit of a background to why you've come from and where you are now? Because obviously you're on the route to becoming an AHP.
Yeah, so I've been out of the army for a number of years, and when I left the army, I worked in security services for a while, which a lot of people do, sort of private security. I mostly specialised in surveillance. Um, uh, I realised that wasn't a long-term career, so from there I decided to go into the healthcare sector. I got a job as a trainer. When I was in the army, I delivered a bit of training and sort of winged it a bit, and ended up getting a job as a trainer. And I worked in the care sector, working with people with learning disabilities for 10 years. And I decided that what I wanted to do was take it to the next level. So I committed to train to become an occupational therapist.
Great. Okay. And David, what about your route? Because you've just recently become a registered physio, haven't you? And you're on that journey now in a career as physiotherapy.
Yeah. So for me, it was sort of similar. I mean, my thing was I was injured and I had to decide what I wanted to do next with my sort of life, and physiotherapy seemed to be ideal in that. And really, my sole, I guess, core value is making a difference. And I thought I could make a difference in the armed forces, and I needed to find some career to do that I could make a difference again. And I think physiotherapists and allied health professionals are ideally placed to make a difference. I think we're the X factor in the whole healthcare system for people. So and it's true. I mean, people, we're great at keeping people alive, but we're sometimes not great at keeping people living, and I think that's what allied health professionals do. And so that's what. So for me, I worked really closely with physiotherapists in my rehabilitation. I had a career-ending injury, and I just was around the physios and around these physios, and I felt they were really interesting. And they were really curious about me, and I was curious about what they did. And so that's why I sort of got on board really, and then focused on becoming a physiotherapist, which I've been in my job over a year now. So great time to start work in the middle of a pandemic. So yeah, it's been interesting.
So could I ask both of you, it's how you sort of went about becoming, moving into the allied health profession sort of sector from your sort of previous roles? I know, Ben, you talked about security, etc. What skills and knowledge did you have to bring to the arena that has allowed you to move into that of an allied health profession? Ben, do you want to go first?
Yeah, I mean, so I'm on a work placement at the moment, a 3-month placement, and I'm working in neuropsychiatry. And I've reflected on this a few times, that some of the things that you learn in the armed forces and some of the traits that you develop in the armed forces are absolutely essential. So it's things like self-confidence is a massive one, and I know that's the army recruitment strapline at the moment, but it is a huge thing. And I'm working with a lot of people, and I see a lot of other students, and they don't have the confidence that I've got. Communication's a big one, but one of the big ones for me is resilience. It's a difficult time at the moment with the whole Corona situation, and you see a lot of staff getting quite frayed and quite fraught around me, and it sounds quite arrogant, but I'm thinking to myself, I just truck on and just keep doing things, and that's how I always am. And I think a massive part of that is my background in the military, and I think that's what it does do for us. It gives us this sort of fortitude that you just keep going.
Do you find that the same, David? Because obviously you, as you said, it was an injury in your case. Your career you thought was probably set out, and then you've had to change path as a result of it.
Yeah, I mean, that wasn't easy. I mean, there's always a grieving process when you change from anything, and that'll be the same. If you're talking about aviation, that'll be the same. But I think resilience is obviously it's a phrase that's bandied about a lot, but there is something around the armed forces and resilience and sort of how you deal with some difficult times. And yes, at the minute it's very difficult, but just getting through 3 years of your degree is difficult. It's a hard degree, and every AHP course. So it's been able to do that, I think. So yeah, resilience is something that, and I think some of the leadership skills that the armed forces give you are important, because as an AHP, you sort of are a real big advocate for that patient. And you might be the only person on that ward or setting in your sort of role, and sometimes, you know, you have to speak up on behalf of your patients and make sure the best care that they need. And sometimes that can be really difficult, and they can be really difficult decisions. But I think that confidence is important. It sort of gives you that. So I think people from the armed forces are ideally placed to have really great careers in the allied health professions or across the board in the NHS. But I guess it's how we get them involved.
And I think that you know, that's the most important thing, isn't it? It's about, you know, realizing you've got those transferable skills. What about qualifications then? Because I think that's something that people worry about. Oh, I haven't got the qualifications. You know, I haven't got all these A levels and that. Ben, what qualifications did you have to get to be able to go on to do your course?
So I had a petals course, or the modern equivalent of that. And I know a lot of people who leave the forces do get those sort of petals and detals qualifications, and that gave me the foundation. I also had some points, UCAS points that I got from another course that I did in my previous job. But one of the things I just want to say is I always felt when I was younger that I wasn't bright enough to do a degree. And I thought there's not a chance I could qualify and do a degree. I had lots of friends who went off to university and did degrees, and I ended up joining the army. I left school, no qualifications, joined the army. Bit of a typical story, really. I think there's a lot of people like me. And I went for an interview at the university, and they said, "Yeah, you've got the points." That's straight in. They were more than happy with me. It's getting those basic points, but when you're there, it's not as hard as I thought it was going to be. It's not easy. I'm not flying through it. I'm definitely not a top student, but I can do it. You know, I can do. I'm going to pass. I know I'm going to pass, and that's all you need to do, isn't it? In my academic studies, I don't get the top grades. I get grades. I don't get the top grades. And then when I'm on a work placement like I am now, I always do really well. Not being big-headed, but I do, and I think a lot of that is down to it's sort of mindset you get from the armed forces.
Yeah. And David, what about you? What about qualifications for you to bring you in to physio?
So very similar in a way. So I went and tried to do my A levels. Didn't really understand why I was there or what I was doing. Didn't really have any ambitions to go to university, and so I think I got like a D in 2Es or something. Absolute waste of time. And then building sites, and then eventually decided that really what I wanted to be as Royal Marine, and I went for it. But I think, you know, I came out, didn't have physio is quite competitive to get into, but as a mature student, I think the doors are slightly open for you because they want these people who've had diverse experiences in the profession. So I did an access course at Walsall College, which was a year long, and on that process you did loads of assignments, but you also applied to university and had your interviews and got in. So in a year you could get into university. It was a really rewarding experience. It justified why I wanted to do it, and the fact that I wanted to get to do education again. And I think sometimes we think we can't do things, but we can actually do them. You know, I think our experiences unlock things, and for me, I decided I really wanted to do higher education, and it was a fantastic sort of 4-year period really with my access course. I think I had lots of offers to go to university. I had lots of interviews, and I think they really wanted, you know, those experiences of the armed forces on their courses. And I know there's always a trickle of people from the armed forces and all the AHP courses. So I think don't let the education off, because it's something you have to do, but I think it's quite rewarding as well, you know.
That's great. And I do know that we are doing some work with the universities to encourage them to explore how individuals who perhaps may not have the traditional qualifications can actually be supported to get onto the current courses. And we are actually working proactively with universities to do that. What about funding, though? Because that's the other big thing I think puts people off. Ben, what about you from a funding point of view?
It is tight with money, to be fair. You know, you have to apply for funding like everything else, and I'm also working, so I'm not going to say it's easy, because it's not easy, but at the end of it, it's going to be worthwhile. So you know, financially, the incentive is there because there's a whole career ahead of you, and it is a good wage as well. But yeah, I'm not going to make out that it's easy, because it's not that easy. It is hard work.
Yeah, and David?
So yeah, so I was on the last year of the NHS bursary, so I didn't pay fees, but it meant that living became quite tight because the bursary never really caught up with sort of inflation and things like that. So yeah, it was quite tight. But if it's something you want to do, then you'll go and do it. And I think, you know, like 3 years, 4 years of being isn't in a whole lifetime really doesn't make any difference, does it? So, you know.
Advice, what would that be? Ben, what is it? What is your top tip for today?
Okay, I think if you have a look at what it is that you want to do, think about in your life that what it is that you want to do, and look at the allied health professions. There'll be a lot of options there, a lot of scope for it. You can do it. It's a possibility for you. I think, like David was saying about the access courses, I think they're absolutely fantastic for getting you on track. So don't doubt yourself. Just have the courage. Look at the access courses if you haven't got the qualifications, and just go for it.
David, what's your one bit of advice then for potential career changers, particularly those coming from the armed forces?
Yeah, I think it's absolutely achievable. My one sort of tip would be prepare for this career as like you did for joining the armed forces. Getting in the armed forces isn't easy. You know, you tend to have a period of like doing physical training, and you've got all the steps you need to get over to get into the armed forces. It's exactly the same for allied health professions. So prepare like for the allied health professions like you did for the armed forces, and you won't go wrong.
Thanks very much. Well, if you're still not convinced that being an AHP is for you, please visit our booth where you'll find a lot more information about AHPs. We've got 2 examples of 2 great AHPs for the future, and one for who's going to be soon, hopefully, will be a fully registered OT. I'd like to thank you very much. I'd like to thank Ben and David, and enjoy the rest of your day. Thanks very much. Bye.